weird thing to be doing for me. All right, so first of all, I want to say hello. My name is Dr. Joyce Kao, Kao pronounced like the animal, and I'm pretty excited to be here with you all. How's everyone doing? I just saw someone posted saying, I just took a poop uninterrupted. Me too this morning. It was amazing. So anyway, I am a pediatric dentist and part of the FUNtastic team, dental team at Long Beach, California. I've been practicing for about 11 years. And yeah, so I was, before California, I was in Massachusetts. I practiced there a couple years. And then before that, I was actually trained in New York at NYU. And I'm actually from Vancouver, so I'm all over the place. So everyone from all over the place, hello. Yeah, so I want to address like the most urgent thing right now that everyone's probably so anxious about is this COVID thing. So how does it affect us as dentists? We're very, very high risk because all the aerosols. And for pediatric dentists, even more so because kids are asymptomatic. So I just want to let you know, if you come across like in a situation where you need to go to the dentist, whether for your little one or your bigger one, rest assured that all of us, we are sourcing and trying to get all the PPEs that's according to OSHA, to the ADA, to the local government, whichever is strictest, we actually have to abide by that. So just so as you know, not to worry, because we are really, everyone's so careful. It's a profession that's just, we're trained to be very, very careful. Like you go to a dentist, we touch your child, we wear a glove. But when I take my kids to get his fingers fixed because he fractured, and the doctor, no gloves. So be very, very rest assured, it's going to be safe, okay? And then also another thing with this COVID-19 is your dentist, your pediatric dentist may be closed, and on their voicemail they would say, oh, we're only treating emergency only. And then you're in the back of your head, you're like, what's an emergency? So a dental emergency, first thing is trauma. So if your kid fall, has bleeding, chipped tooth, call your dentist, definitely, okay? And another thing is actually facial swelling and infection. We take infection very, very seriously. So if you think your child has a dental infection, like a swollen face, a little bubble on a gum right there, call your dentist too, okay? All right, so back to our schedule programming. That is the earlier years. So we're gonna talk about how to take care of your kids from the age 0, when they were born, to age 5. I myself, I have twins that just turned 4. So we're in this together, okay? I'm in this as a pediatric dentist and also as a mother. So I know the struggle and it's very real, okay? All right, so first thing is from birth to 6 months, okay? So we're gonna break it down into kind of like a milestone ages, and then we'll go from there, okay? First stage is 0 to 6 months. And just, I think there's some questions coming in. Just let me, just technical difficulty. Give me one moment. Okay. All right. So, for babies, newborns, you'll be like, they don't have teeth yet. What do? Do I see a dentist? Do I not? So here's the thing. Starting from birth, you want to set that habit, okay? You wanna set that habit, and you want to really to have your child be on a good track, to be cavity free the whole life. So give me one moment. I'm actually seeing someone saying that I'm not on before. Yeah. So it was you want to set a habit. So for baby from about 0 to 6, there's no teeth. Usually babies start teething around I've seen it as early as 4. Textbook says around 7. So around like 6 month-ish, 5 months-ish, you should start seeing some signs of teething. Okay. Teething, kids teething, not fun. Okay. They could get drooly. Sometimes people even say they have this like drooly rash. My mom swears that they get diarrhea and fever. None of it is actually correlated by research. Okay. So research has really not pinpoint any sign that's related to teething. They're going to be uncomfortable for sure. You're going to be like, oh, they're waking me up at night again. So the thing is, make your child as comfortable as possible. And I can't stress enough, you can get a lot of products on the market. There's herbal ones, there's Orajel, there's, all kinds. Read the label. In the back, if it says it contains benzocaine, it's a topical anesthetics. Don't use it, okay? For a child this young and anyone under age of at least 2, don't use anything that contains benzocaine. Other than that, just trial and error, whatever works. Most of the time, what helps is, like a cold temperature thing. Parents have told me they use a little washcloth, dip it in breast milk, and actually freeze it to make a little breast milk popsicle that they can just suck on. Okay, not ice cubes, It's a choking hazard. So like a washcloth. Okay, that's also a good idea. You kind of want to gently massage the area too. It can relieve some of the pressure. It's not uncommon that they can have a little bruising appearing. Okay. So if you see a little bruising, could be a little like purple, bluish looking, don't be too alarmed, but do go to your pediatric dentist, okay? We want to take a look at it and then to see what's the timing and then take everything into consideration. Most of the time, it's just a little bruise for the new tooth, okay? So how do you clean your baby's mouth? Because there's no teeth. At this time, couple of good habits you want to get into is, first, don't put your baby to bed with a bottle, because if you get into that habit, it's going to be very, very hard to break. Like pacifier, I myself went through that struggle, so we'll go over that a little later. Okay, so never put a bottle to your child's bed. It's actually for a young baby, not only for dental consideration. If a baby's feeding by itself at night and no one's watching, it's also, choking hazard too. And then they can choke, you don't notice, so don't do that. We're feeding and then we're breastfeeding, we're bottle feeding. Try to clean around the gums after you feed. So kind of reduce that amount of milk, because it contains lactase, which breaks down to simple sugar too. So kind of just wipe it around. So you can use a gentle, like a washcloth with water, that would be good enough. Sometimes when the kids are getting a little older, when their immune systems are a little better, I actually started my own kids on a xylitol wipe. So kind of like this. Dr. Brown has one. There's all other brands here. I'm not associated with Dr. Brown. No kickbacks or anything. Just something that I use, and then my kids actually like the grape flavor. So xylitol, that's XYLITOL. It's a good sugar alcohol. It kills the bacteria, it inhibits the bacterial growth for the cavity. So it's kind of like it's a good thing to have. But if you're concerned about newborns and their weak immune system and potentially having diarrhea from the bacteria and things like that, then just water's fine. Okay. All right. So that is for the newborn years. And then another thing I want to stress is moms. You just popped out a human being at this age. If you have routine dental care, most likely it was deferred, okay? Most likely your dentist is like, let's wait on it. Go back to your dentist once you have the baby, do a good checkup, okay? Because research has shown the bacteria that actually causes cavity can be transmitted from primary caregiver to the kids, okay? So if you have bacteria, active decay, like active cavity in your mouth. It's very, very, very possible by kissing or kind of sharing a spoon, sharing a utensil, you can potentially transmit that bacteria to your child. And think of the mouth as a garden of bacteria, like normal bacteria, good, like gut bacteria, we have teeth and mouth bacteria. So you don't want the cavity causing bacteria to be the dominant strain in the mouth. So you kind of want to avoid introducing that much of the bacteria in the mouth in the early stage. Okay. All right. So that's the 6 months to 6 months, up to 6 months. So now it's 6 to 1. They're definitely teething. Okay. At this stage, we're introducing solids. So definitely when you start introducing solids, you want to start brushing their teeth. Okay, and when they have teeth, you want to brush their teeth. You can use the silicone one on the finger, that helps. Okay, or if you like, it's easier for you because kids do bite, and they bite through silicone stuff too. Trust me. You can use a baby toothbrush. Okay, my personal favorite is actually something Japanese, and I came across it when I was traveling overseas. These ones, it's called Pigeon, like the bird. It's a Japanese kind of like, it's a big Japanese kids brand. It's like a Japanese munchkin pretty much. And they have these teeny tiny toothbrushes. They're so awesome and so soft and tiny enough for you to use it on your child. These ones are for bigger kids, I just showed you. They actually have really infant ones. I had to stress that they don't have a stopper. So don't give it to your child to play around with. It's something for you to use on your child. So start brushing in that area, and first the teeth come in and you're eating solids, you want to clean the teeth. And then, so let's talk about the eating part. Okay. So, at 6 months, we start to transition to sippies or a cup. And I got a lot of questions like, how long do I need to use sippy for? What kind of sippy do I use? Do I do straw? Do I do this? There's no concrete research, and then the consensus in the current guideline is actually avoid sippy, and the straw is sort of okay, but sippy, any spouts that kind of encourage the whole kind of like a sucking motion, minimize that transition period as short as possible. So I, again, mother of two, I use this, okay? It's a rim cup, and then it really mimics the normal drinking muscular motion for your child. My kids don't take it at first. I had to do like a couple months of sippy, and I went through about 6 kinds. Okay, so it's just a lot of trial and error. Just find something that works for you. Okay, and then slowly introduce a cup. You can do it straight from a cup, and if you like me, don't like spilling, and you can use a magic one like this that doesn't really spill. Okay. There are so many different kinds out there. That's a munchkin one. There's so many different types out there. The idea is if it's a rimmed cup, and then you kind of have that rimmed drinking motion. That's good. Okay. And what's in a cup? No juice. Okay. Actually, the American Academy of Pediatrics recommend no juice under age of 2. It's not only for teeth, and also because obesity nowadays in the US is very prevalent. So juice actually has a lot of sugar. And I get parents like, oh, we diluted half. It's still a lot of sugar. And then here's the thing. I would rather have a 2.5, 3-year-old sit there, drink a glass of juice just in like 5 minutes and be done with it, rather than a half cup of juice with some sugar in there, diluted, and then taking on a sippy cup and sip throughout the day. That's like soaking your teeth in sugar water every 5 minutes, right? So that's what you want to do. No juice under age of 2, okay? And then when it gets later on, we'll talk about that a little later, all right? We have cleft palate. We have a question right now. It's really important. I really want to address that because when I was training, I actually we had extra training on that too. So I may not be able to get to all the questions this time. I will go back to it. Our marketing director, Eileen, is actually messaging me all these options. So this one, I'm going to address it because it's kind of dear to my heart. I've seen a lot of patients with this condition. It's cleft palate and lips. So it could be lips and palate or either one. What's the best option for dentist? So for any kids that has a cleft lip and palate, you need a team approach. Okay, so you need a team of plastic surgeon, you need a team of oral surgeon, you need that has oral surgeon and has a pediatric dentist and has a orthodontist that has experience with cleft kids, or there's certain fellowship there that's cleft ortho as well. Okay, so you want a team of all these specialists. And for us, for dentists, you definitely want to have a pediatric dentist because we have this extra training. We actually have to go rotate through the hospital that we're working at, their cleft centers, okay? So we spend some more time, we see it, and then we have extra training and exposure to know when to do what. Timing, as we know, is very essential for cleft kids. At this age, you do this age, you do that. So you can actually ask your cleft team to recommend one that they've been working with, that they've had a course. Because whenever I see a cleft kid, their first thing is sent out an email, a mail asking the team, what's your plan? What do you want me to spot? Because we, as dentists, we see the child every 6 months or even more frequently, okay? The team, once the surgery done, may not even see the child for a year or two, okay? So corresponding with the team member is very, very important, okay? All right, so let's get back to schedule programming again. So for between 6 to 12 months, so no juice, rinse, cup as soon as possible, but don't go crazy. Sanity, very, very important, okay? So right now, you really want to start looking for a pediatric dentist, okay? You want to establish a dental home for your child. The dental home is something that a PD is really, really trying to put out there as a public health promotion. It's like pediatrician, we have a medical home. Oh, it's like, oh my God, my kid has a fever. What do? You call your pediatrician. It's like, that rash looks weird. You call your pediatrician. Same thing, we want to be there for your child as a dental home. You'll be like, ooh, that looks like a bump or like a canker. I'm not sure. Who do I go to? My dentist? My neighbor's dentist? So right now, it's a good time that you find a dental home for your child. So find a pediatric dentist, AAPD, go to American Academy of Pediatric Dentistry, or if you're in Canada, Canadian has our counterpart too, the CPD, and then go on the directory, you can find your local pediatric dentist, okay? So establishing a dental home once your child's teeth comes in is very important. The guideline actually says before the age of 1, you should see a dentist, or within the 6 months of the first tooth erupts. So it's definitely a good time to start looking and then be at the office, maybe for a social visit, bring your kid in to play around, just be familiar with the space, okay? So also another common question between the 6 to 12 month age is breastfeeding and stopping breastfeeding and all that. So it's a very, very sensitive kind of topic. Everyone's different. Every child is different. The CDC recommends at least breastfeeding to 1 year. It may not be possible for everyone. And then the WHO, because it takes into consideration of all the country in the world, actually recommends at least to 2. Some part of it is because in certain area of the world, breast milk past age of 1 is actually more nutritious than the food that they have access to. Okay, so it's a lot of consideration. Do what's best for your child, okay, and do what's best for you. I breastfed my kids until age of 1, and then it's a personal choice. I'm like, I am going crazy pumping, so I stopped. And I applaud everyone that can, feed through any means to your child, past 1, and it's a personal choice. And You'd be like, oh my God, I'm worried about breast milk rot. There's actually no concrete research evidence linking nursing anytime to cavities until solids are introduced. Okay, so that's a caveat. And when the solids are introduced, the bacteria gardening in your child is a little different. So at that time, yes, we pediatric dentists actually do see kids who tend to have more cavity when they're breastfed throughout the night. But there's no concrete evidence. I just have to let you know that there's no concrete evidence from research. Everyone's different. I like to tell the parents is, some kids, they wear short sleeves and like shorts and go and play in the snow. They don't get sick. And my kid, when it's like wind starting to blow a little bit, and they get sick. So every kid is different. So the risk and then management, and then how to assess whether your child is at risk for more cavity, and then how we recommend, that's really stop that middle of the night nursing recommendation. It's not made like one for all. So very important, establish your dental home, go to a pediatric dentist, and your pediatric dentist will actually take a lot of things into consideration and then tailor-made a recommendation for you, okay? And so at this time, another thing is be comfortable of getting inside your child's mouth, okay? What the gum looks like when it's normal, what their teeth look like when it's normal. Lift up, this is gonna look funny. Lift out the lip like that to check along the gum line too. Sometimes the very, very, very early sign of cavity starting is actually, I'm a little hesitant to come in, so sorry about this, along the gum line in this area, okay? Sorry. You see very, very beginning is a white spot, okay? Kind of like a chalky white spot. That for us pediatric dentists is a risk indicator of cavity. Okay, so when we actually do infant exam, like a baby exam, that's what we're looking for. Okay, so to sum up, the 6 months to 12 months kind of age, first, establish a dental home for your kids. Second, teething baby, whatever works, don't use benzocaine. Okay, start brushing. Then again, whatever works, watch out for your own finger. Sometimes I have this question for parents, like, do I use a toothpaste? Do I use not? Actually, the ADA, because the cavity is so prevalent now, especially in the United States, it's actually one of the most common chronic child disease in the US. It's 5 times more common than asthma. Because of that, such high population with cavity, the ADA actually and AAPD changes guideline to using a fluoridated toothpaste as soon as you see teeth. Okay, so for people who came out we're a little older, we are used to the old guideline, we're like, oh, maybe a little overkill. Then again, it's not something that's one policy fits all. You may be low risk, you may be high risk. I've made different kind of recommendation. I look at a baby, I'm like, oh, there's a cavity, let's start using fluoridated toothpaste, but a tiny bit. Or I'd be like, we're fine with just water. Okay, so there's a wide range of what you should do. Most of the time at baby stage, if you're comfortable with it, you use fluoridated toothpaste. Obviously, they're not going to spit it out. Literal smear, like tiny smear, about a rice grain size. And not the Japanese grain, like a basmati rice, like tiny ones, okay? Okay, and so other than that, get comfortable getting in the mouth, know what your child's mouth looks like, because sometimes if they walk around and they bump their head and then bump their teeth, and you're like, does that teeth look normal? Did it move out of place? Trust me, it happened to me. I was like, what did he look like before, right? So just be comfortable with that. And transition to rims, right? All right, so we're gonna start talking about the toddler years. The toddler years, early toddler, like from 1 to like 1.5 and 2. The difficult times, yeah. So by this time, your child, you should already have established a dental home for your child, being seen by a dentist, especially most of the time, this kind of visits is very, very quick, okay? I actually the first thing I tell parents is, I'm going to spend more time talking to you than examining your child, because the examination we're trained to do is super fast and then get to the point. Most of the time we'll do a lap to lap approach. So kind of like this, okay? You will be sitting and then kind of wedging there for your child's legs so they don't kick anyone. Trust me, I've been kicked by my own child. And then the child will be in dentist's lap, and then we can really see everything from that angle with the light. And then there are other things that we can do in this kind of examination position. So it's a very, very useful kind of position. And then what you can do is at this age, because they know more than the baby, so you can just actually do this at home with them. Brush their teeth with them. Like if you have someone with you, try this. You can Google lap to lap in this position. So have them be comfortable with it. Okay. So this is a technique that we usually use. And then at this time, you really want to establish that brushing at least twice a day kind of routine. Okay, so from like 1 to 1.5 to 2. And then people are like, oh, do we floss? Yes and no. Okay, so it's not everyone. Like getting a toddler to brush is hard enough. And then sometimes we're like, Mom, sorry, we need to start flossing. So the rule of thumb is, if the teeth are wide apart and you can see the gum in between, you can actually brush it really nice and clean. For some kids, their teeth come in very, very crowded. There's no space like this. Then you definitely want to start cleaning in between. I have not really seen any cavities in between the teeth when their full front teeth are wide apart. Okay, most of the cavity that's in between the teeth are the teeth that's tight together like that. All right, so so yes and no. If you see your child having like really, really tight teeth, but get those like floss sticks. And then you don't have to floss, like, you can introduce it earlier, have them play. And, have them see how you do it and then make it into a game. And then tell them it's a tooth ribbon. And then just clean between the teeth. So you really want to establish that routine. Then again, can't stress this enough. The AAP actually recommend no juice under age of 2. Okay, so this is still at the age that you really don't want to do any juice. So at this time, it's about time that you start to thinking about introducing fluoridated toothpaste. The old guideline says nothing under 2, and then you change to like 1, and you do a little smear. Then again, evaluate what's best for you, and then what your dentist recommends. I started my own kids at about 1.5, and then you can really start to have them, train them to kind of spit out the toothpaste at the same time. If they don't spit out, I can't stress this enough, tiny bit, rice grain size, that's really, really good. Okay, and toothbrush, what I find, at least at Target and Walmart, is all the toothbrushes for like a toddler, like 2 to 5 year old, man, they're huge. Like for a 2-year-old, how do you get that thing in their mouth, right? No wonder it's a struggle for parents. They tell me, oh my God, it can't go to the back. I can't get along the gum line, because that's a very common area for cavities, gum lines. They're like, I can't get there. They hurt. Try this, okay? Try the teeny one, whatever you can find. And if you think, it's a little tricky to use, you can always fold back a size, even if you can't really find that toothbrush on Amazon anymore. Is do the infant size. I find the infant size that you find at Target is fairly small. Okay, so you can definitely use it for a toddler. Okay, and then again, lift up the lip and check for your kids. And at this age, we start to see more kids with early childhood decay. So severe early childhood decay, and that will be the bottle rot. So we start seeing that too. So you really want to establish a good habit. And then here, we'll touch on the good habit a little later on the late toddler age too. It's very similar to the 1 to 2, and then 2 to the 1.5 to 2 year. So to sum it up, already be at a dentist, introduce fluoridated toothpaste, and still no juice. And this time they're teasing the molars in the back. They're terrible. I know, they're terrible. Hang in there. You're almost there. Okay, you're almost there. All right, so we're gonna start talking about the late toddlerhood to preschoolers, like the 1.5 to 2 to age 5. So this age, at this age on, you really want to have a good habit. So this is majority of the kids that start the habits start to accumulate to become a cavity. So a good thing is think of sugar in terms of frequency and not the amount. So a good analogy, not saying that you should do it, is a bag of gummy bear, okay, or goldfish. If you want to sit there and eat that bag of gummy bear in one sitting, then it's sort of okay. You clean your mouth afterwards, you're good. If you have one bag of gummy bear or one bag of goldfish and you go there and you put it on the table and you have your child graze throughout the day. So 10 minutes, run around, take one bite, run around, watch TV show, and then take one bite, okay? That will actually increase the cavity risk, okay? It's the frequency and not the amount. Amount too, it's not saying like you should like eat a bag of gummy bear in one sitting. You will have a stomach ache. I tried it. But just the idea is have a set meal time and set snack time. So 3 meals, 2 snacks for children, for kids this age. You sit there, finish your thing, you leave the table, and just water in between. That's probably the best practice you can have, okay? Definitely from start 2 on, you want to brush with fluoridated toothpaste, okay? So if they can spit, do about a pea size. That's a good amount, okay? Definitely not like the toothpaste commercial, you squeeze one caterpillar shape. Pea size. No spitting, stick with the smear, tiny smear of rice grain size, all right? Then again, teething molars, they're the pain to teeth, okay? They're gonna keep you up. Again, no benzocaine product, okay? At this age, they're really like, especially at 3, they want to be a big kid. Like, I'm a big kid now, I can do it. A lot of parents are like, oh yeah, they do it really, really well. They'll let them brush their own. They don't, okay? So make sure you're always brushing your child's teeth at least once or twice a day, okay? Find a routine that works for you. Personally, I let them do whatever in the morning, but at night it's so important because when you sleep, you don't create saliva and the bacteria just grows. So before the bedtime, I actually brush my child's teeth, okay? And I get parents like, oh, they find me, they wouldn't let me. Let them do it, and then you can go over, okay? Before your child can tie their shoelaces, they actually don't have the dexterity to brush really well on their own. So you always want to help them out, okay? Whether it's 6 or 7, when they develop that dexterity, you always want to go in and then do a 1-over to help them out. Personally, I would do it until they're 15 or 18. Yeah. So again, continually, this is the age where the cavities start to pop up. And for some cavities, they're in between the back teeth, like in between the molars. When they're small, you actually don't see them in the mouth, and you see them on x-ray. And that's why we actually start taking x-rays when the teeth are contacting each other, and then when the child can allow it. And a lot of times we're surprised because in the mouth they look good, and then with the x-ray, boom, 8 cavities, okay? And you actually see on x-ray. And what happens is as those cavities, get bigger, the top part of the teeth actually crumbles down and you see a hole. So that is something that, if the child cannot tolerate x-rays yet, it's something that's very important for you to spot at home in between your dental visit. So a good tip to check your child's teeth is pull down the lid, check around like that. Definitely pull up the lid like that and check for edges, okay? And then to check the top teeth, you actually want your child to tilt the head all the way up, all the way, and then look up, okay? So that's a good way to check, all right? So that's about the age 2 to 5. They're smooth sailing now. By now, you should really, really have a habit of, a good dental routine checkup every 6 months, and then definitely on a cup now, and start using fluoridated toothpaste and have a oral hygiene routine at home, okay? And I know that part of what want to talk about is hacking your first visit, your first dental visit, okay, is what to prepare. So first is set your intentions. I know it's like yoga class, right? And you want to figure out what you want to know from the pediatric dentist, okay? And then any specific issue you want to address, whether it's staining, toddler, or you just want to know what you do at home and what to expect, okay? We are here and we're very, very happy to go over everything with you. And then the second thing is set your expectations. Kids are kids. My own child are terrible at the dentist, like terrible. So set your expectations. Some kids are magical. I have twins. My boy at 10 months was like, whatever. My girl still cries. Yeah, she's that one in the office. So in your mind, you think about where your child cooperate, how much you want to get from this visit. If you're concerned about cavity, how far would you think you will go? Because sometimes we have to do what we have to do. If I see a cavity in there and the child is not having it, we may have to, be a little forceful, have mom hold the child a little tighter, and then we need to, get in there, really assess, whether it's a cavity or not. So how far do you think you will go to have your child assessed? And then, so that's something that you want to set your expectation to. And then the last thing is make it fun, okay? Peppa Pig, Paw Patrol, Daniel Tiger, everyone goes to the dentist, so make it fun. Introduce that to them, okay? So now I'm going to answer some questions. Let's see. Poke it and get American. Okay, so a tooth with an abscess on a 4-year-old, I can tell you that tooth needs to be extracted, okay? Yes, the symptom can go away once you poke that abscess and drain it, okay? And antibiotics can control it. The source of the infection is actually inside the tooth. And you can, with antibiotics and drainage, it's outside of the tooth, okay? You will relieve symptom, but the source is still there, and it will become a chronic infection, and it can affect the development of the permanent teeth that's right inside, because an abscess, whether it's a chronic or acute abscess, is very acidic, and our teeth, when it calcifies, doesn't like acid. So definitely take your child to a pediatric dentist, and if it has an abscess for that long, I will recommend an extraction, okay? There could be heroics that could be done to try to save the tooth and then keep it inside the mouth. It really depends on how well your child will cooperate. Sometimes a child can cooperate through a longer procedure. We can give it a try. But if your child is kind of like my daughter's, run out of the room when she sees the needle, extraction of that baby tooth may be the best way to go, okay? So, even draining it is not, we don't drain it, okay? Draining it, it's just, how do I say? It's not the standard of care to drain the abscess, and it doesn't take care of the source of the infection to begin with, and then you poke a hole in the gum and it's gonna hurt, right? So take your kids to a dentist. It needs to be addressed, okay? And then let's go down to, yes, for babies with no teeth, you definitely want to clean the gum, okay? So think of this as gardening. You want to culture this clean slate with good bacteria in the mouth. So yes, do clean with cloth, water, and finger. So do a little swipe after you feed. That's good. Okay, and then we're going right front tooth. So if your child is 5 and has a tooth that never grew in, so it could be one of the laterals, or it could be one of the laterals. The lateral incisors, the front tooth, because I'm not clear with which front tooth. We have 4 front teeth. These laterals, those side ones, they're actually very common to be missing. So not very common. It's not uncommon to be missing. So if you're missing one at age 5, chances are they could be missing in the future. So it's not uncommon. And then definitely take your child to see a pediatric dentist, have x-rays done. If your child at age 5 has a missing tooth and it looks like as if there's special space left for a tooth, then we want to think towards whether there's something blocking the tooth from coming in. If it's a missing tooth and then the teeth are more spread apart, then it's most likely just a congenitally naturally missing teeth. Then again, without x-ray, it's really hard to tell. So don't be too worried, but do take your child to a pediatric dentist and get some x-rays, okay? And ways to encourage a 2-year-old to brush teeth, aside from wrestling down to be able to brush them. That's a personal struggle too. Okay, so a 2-year-old, they're tough. Is make it into a game. I saw on Instagram, there's this new toothbrush. It has a game, and you're brushing, it has a sensor, and make it into a game. If you don't want to introduce screen time, unfortunately, there's like Oral-B has an app out there that make brushing a game. It really depends on your child. There's so many different ways. If they like to help, you're like, hey, help me brush. You help mama brush, and then mama will help you brush. A lot of times as parents, we have to resort to kind of fight them. The thing is, when you fight with them, the last thing you want is give in when they throw a fit and then throw a fight. You're rewarding that behavior by not brushing them. So even if you go in there like 1, 2, 3 and we're not doing anything, but it's a win, okay? Behaviorally, it's a win. So maybe today they let you brush for 1 second, tomorrow it's 3 seconds, and in a week they let you brush. So there's so many different ways, so you kind of just had to test out what's best for you, but definitely by all means have a tiny win for you as a parent, because the last thing you want is really rewarding the fighting, the kicking, the screaming with like, oh, okay, let's not do it. So that kind of will set you up in the later on stage to be really, really difficult to brush them. And let's see, we have whale water, which doesn't contain fluoride. Hi, I actually work in an area that has well water in Massachusetts. There are certain pockets in Massachusetts that have well water. So first thing, get your water tested, because there could be naturally occurring fluoride from the geological layers. And actually, I have patients, they get their water tested and they actually had a spike of fluoride that's even higher than the 0.001 ppm that our water has. Okay, so don't automatically assume that if you have well water, you have no fluoride. Yes, fluoride is a natural occurring thing, and then sometimes depending on the geological activity, it can actually spike. Okay, so you can also cause fluorosis. So first get your water tested, and if it really does not have fluoride, back when I was training, we write out fluoride supplements. Okay. And then now the research has shown, topical kind of just rinsing is better than systemic that you take. So, if you're comfortable with fluoride supplement, there's actually a specific guideline with the amount of fluoride in your water and then the age of your child. Go to your pediatric dentist, they will make recommendation. And another thing is, most effective way of fluoride is actually topical, meaning a rinse or toothpaste. So if you're thinking, I also live in an area with no fluoridation, but I don't really want to take that systemic fluoride, what do? You can use toothpaste with fluoride. Okay, there's actually some toothpaste with stronger fluoride, which we usually prescribe to kids at higher risk. So if you belong to that higher risk category and you want some more protection, go to a dentist and they will be able to write a prescription for you for a fluoride with higher fluoride concentration. Another thing you can do is actually fluoride mouthwash. So ACT and Listerine all have this anti-cavity line. That if you read the back ingredient, the active ingredient will actually say fluoride in there. So look for that. Don't use it unless your kids can spit. So do a little spit test in the cup, draw a line, have them spit back in to make sure they're spitting, since we don't want them to swallow, okay? For younger kids, that if you really want to do this, I have mom that's pretty adamant about, like, I don't want systemic, but I want more fluoride in there. Take a little Q-tip, dab it in, and kind of just do that. And there's also other products out there. This is called Carry Free, and also called MI Paste. They have other ingredients that help straighten your teeth without fluoride. Okay, so again, go to your pediatric dentist, your dental home, and ask your dentist to make a recommendation for you. Okay, and let's see. All right. So for bottled water, okay. So when I worked in New York and in Boston area, we actually have a lot of people who are drinking bottled waters only. Especially area where drinking waters is like, yes, bottled waters sometimes don't. I mean, most of the time they don't. They're actually in areas that they sell bottled waters with fluoride. Okay, so if you want to add some form of topical fluoride in there, you can look for those topical water. But yes, there's research out there that do see higher cavity rates, for kids who do bottled water only. So if you do water bottle only, another thing is it gets a little complicated because the kids can go to school, and in school they get tap water, or you cook with tap water and your area is fluoridated, so they're still getting some fluoride in there. You make that pasta with regular tap water. Brita doesn't take out the fluoride in the water. Only reverse osmosis take out the fluoride in the water. You're still getting some in there. So I would say, unless you cook with bottled water as well, your chances are your child is also getting some fluoride in from the tap water at school, or when you're cooking. All right. And let's go down to 21 months. All right, so we have a 21-year-old kid. Okay, so mom, I hear that question. The 21-year-old child really likes to gnaw on just hard stuff for teething. I know kids can be very difficult when they teeth. The thing about hard object is most of the time, because kids at this young age, if it hurts, they stop doing it. So I would say don't worry too much about them hurting themselves on a harder object than it being a choking hazard. If he really, really likes to do it, you can get the chew toy and then put it in the freezer a little bit, makes it a little hotter, and the cold temperature actually will help soothing the pain. But otherwise, I would not recommend chewing on ice. Again, it's a choking hazard and it's really harsh for your teeth. Sometimes when it's just so uncomfortable, because I know sometimes they teeth like a champ, they just like pop out 4 or 6 at the same time. It's so uncomfortable. You can actually give them a little painkiller, Advil or Tylenol, whatever you have at home, and then the dose should be according to the weight of the child. Okay, so that's something that you could do for them. All right, another question. So for almost 2-year-old, we have 70 so far, 2 on the bottom, and then so 5 on top. For an almost 2-year, not too bad. Okay, not too bad. Most kids have all their 20 baby teeth by the age of 3. Okay, and so around 3.5-ish, you want to see all baby teeth. And before that, it's kind of like a free-for-all. Unless you're super late or super early, then we start to be concerned. The thing to look for is a pattern. Is the pattern like, bottom, top? Did they skip a teeth? Did they not teeth, or did they only teeth the top? I would say your situation is not too bad. Not too bad. Every kids, they have their own schedule. Some teeth earlier and pop everything out at once. Some teeth later and really take their sweet time. So I would say don't be too alarmed if there's only 2 for an almost 2-year-old. Sometimes they just take a little longer, but then again, at this age, you really want to have a dental home where there will be a pediatric dentist that's familiar with the pattern that your son's teeth are coming in. I've had kids who came in at 12 months, like 2 and 2 really cute, and we're like, oh, we're good. And then 6 months later, oh, we're good. And 6 months later, and then we're like, I don't know, it's a little asymmetry. Another thing you want to look for is also asymmetry. If there's asymmetry, then we want to take x-ray to make sure nothing else is going on. So again, don't be alarmed. I think it's okay, but do have routine exam by a pediatric dentist. And another thing I want to kind of touch up on is, I kind of get this a lot, is a lot of times it's very, very normal to have this canine come in after the first molar, okay? So that pointy, call it eye tooth, sometimes it's normal to not have that yet and start teething molars in the back. Kind of be patient with it, wait for like 6 months-ish. If it pops out, awesome. If not, most of the time, not a big deal. Still, by this time, we already have dentists seeing it. All right. And then, by the way, no question is random question. Every question is a good question. If there's more, because I for some reason, I can't see the comments. So our marketing director, Eileen, has been text me all the message. So if I miss anyone, she's actually collecting them, and I will reply to you on the comment section, okay? And so I think this concludes our session for today. Feel free to send us more questions, and then we are there are pediatric dentists in your area, and then for me, I'm in Long Beach. The office is FUNtastic, and I think Eileen is gonna run a little special for you guys with the link, so kind of watch out for that on the Facebook page. So our office will have a little special if you happen to be in Long Beach and or surrounding area and participating in this kind of talk. And I hope this is very informative for you, whether your child is a newborn, couple months, or a toddler running around. And we're all going through it, quarantining with toddlers. You see, there's no time for makeup, and then the roots and the glasses hanging there, everyone. We can get through it. Any question, reach out to us. I'm more than happy to answer. Okay? Have a good day. Bye.